Hi, I'm happy you're here. My name is Doc.Med.Farshi. For over 20 years, I've been passionate about my work as a dentist in Hamburg, and I'm also a book author and one of the top specialists in Europe for the treatment of temporomandibular joint diseases, called craniomandibular dysfunction, or CMD for short. When we talk about CMD, we are talking about a disease that affects the jaw, more precisely, the upper and lower jaw, the jaw joints, and the chewing and neck muscles. It usually radiates to very different parts of the body and causes pain there. If a malposition develops in the mandibular joints, or there already is one, for example, if the position of a tooth has changed due to grinding or pressing, or as a result of poorly fitted dentures, then this can really mess up the whole body in a very detrimental way. It can cause numerous symptoms that you would never think could have originated in your temporomandibular joints, such as ringing in the ears, migraines, tinnitus, or even back pain or other dysfunctions. And unfortunately, you're not alone. Most doctors and physiotherapists who treat these pain symptoms also do not recognize that they are caused by CMD. Instead of starting with the true cause, the practitioners only look at the symptoms. They only treat the symptoms, not the cause. But you can only achieve freedom from symptoms in the long term if you successfully treat the cause. If you suspect that this could also be the case for you, and that you could be suffering from craniomandibular dysfunction, for example, because you have taken the self-test in my new book, The Jaw Code, then it is best to take action and make an appointment in a dentist's office that truly specializes in CMD in your area. I would also be very happy to see you at my own practice in the center of Hamburg. Since CMD is affecting more and more people, more and more dentists are now treating it. But beware, there are actually very few true specialists in this field. Thanks to my many years of experience and my additional master's degree from the Medical University of Innsbruck, I am one of the best known and most committed specialists in Europe. But I don't just lecture, teach, and write books. I also work with people who are affected. Someone recently asked me what makes me different from other doctors working in this field. Well, that's a valid question, of course, and I can also answer it. It is the combination of my expertise, many years of experience, and, as a patient from London recently said to me, magic hands. Because to get a malfunction of the jaw under control, you need well-trained hands that know what they are doing, as well as empathy. And because of these skills, it is now not only patients from Germany who I can support on their journey to a life without pain, a wonderful task that I enjoy performing every day. Therefore, what essentially awaits you if you come to my practice suspecting that you might suffer from CMD? The most important thing, CMD treatment is basically painless. You don't have to worry that it might hurt. At the initial consultation, we will have a relaxed discussion about your complaints. During this, I will write everything down to the last tiny detail. Of course, it is the symptoms that have no clear explanation and therefore no derivable cause that are particularly interesting to me. But new symptoms are also interesting. You can really tell me everything, even about the symptoms that you would never ever associate with your jaw joints. In this context, we also talk about the dental treatments that you have had, ones you've had recently, but also any that you had a long time ago. If you have any documentation, please bring it with you. I will also ask you what has already been done to address your symptoms, both by yourself and by other doctors who have treated you. Maybe you've already had physiotherapy or your orthopedist prescribed insoles for your shoes. It is important that we document everything so that we really have every detail down on paper. Then it's on to the examination. I use my own personal DocFarshi method. It is based on scientific findings and is the result of my many years of experience with CMD. And what might surprise you is that during the examination, I look not only at your face, jaw joints and teeth, but also at your muscles, posture standing and lying, and your gait. CMD can affect almost every part of the body and cause problems everywhere. Therefore, I really have to look at the whole body as a CMD specialist. And once again, the entire examination is completely painless and takes about 1 hour. The initial consultation is really very detailed and important. This is because CMD treatment only makes sense if you really do suffer from CMD. In other words, if your symptoms have a descending course. If it is clear that you suffer from CMD, we will have a separate, pressure-free discussion about the treatment and what you can expect from it. The main element of treatment is a CMD splint that is made especially for you. They look like this. CMD splints ensure that your bite is exactly as it should be without stretching your muscles. Your teeth basically don't know exactly how and where to bite. However, the CMD splint must be worn day and night for them to learn this again and get used to the new normal. This is the only way they can make a difference. But don't worry, you can take out the splint when you eat. And for many people, this is also important. As you can see, the splint is transparent and thus almost invisible. The front tooth area, which is at the front here, is even left out. And it is also clear the splint does not affect your speech or everyday life in any way. If you decide to have your CMD treated, I will take an impression of your upper and lower jaw and accurately map your bite. Look, the plate looks like this and is then placed on your teeth. Finally, I measure the exact position of the jaw in relation to the skull with a face bow. All of this data is then used to create the CMD splint. If you really do wear the splint day and night, you will feel noticeable improvements after a short time. However, issues that have been bothering you for a long time often take a while. You could say that everything has to get back on track. During the treatment period, which lasts about 6 to 8 months, we will of course meet regularly to see how things are progressing and whether and how your symptoms are improving. Lastly, I'm sure you have one further very specific question. How much does all this cost? CMD treatment is usually a private investment in your health. An initial consultation with a specialist costs between 300 and 500 euros. However, this is a really good investment that can save you a lot of money and pain from unnecessary and ineffective treatments in the medium to long term. The entire treatment process, which can take up to 8 months, can cost approximately 1,000 to 5,000 euros, depending on the complexity and intricacy of the treatment. In addition, there are costs for osteopathy, sports medicine, or physiotherapy that may be partially reimbursed by your health insurance company. However, I can assure you from my experience, the pain of the cost is quickly forgotten. A life without pain, on the other hand, remains a long-term benefit for you.